Dissociative disorders are a complex group of mental health conditions that involve disruptions or breakdowns of memory, awareness, identity, or perception. These disruptions can interfere with a person's general functioning, relationships, and daily life. The term dissociation itself refers to a disconnection between a person's thoughts, memories, feelings, actions, or sense of identity. These disorders are often associated with trauma, and they exist on a spectrum from mild to severe. Understanding dissociation. Dissociation is a psychological process that can occur as a response to trauma or stress. It is a way for the mind to distance itself from experiences that are too overwhelming to handle directly. While occasional dissociation is a normal coping mechanism, chronic or severe dissociation can lead to dissociative disorders. Types of dissociative experiences. 1. Depersonalization, feeling detached from oneself, as if observing oneself from outside the body. 2. Derealization, experiencing the external world as unreal or dreamlike. 3. Amnesia, memory loss that is more extensive than normal forgetfulness and cannot be explained by a medical condition. 4. Identity confusion, a feeling of uncertainty about who one is. 5. Identity alteration, the presence of distinct identities or personality states that take control of the individual's behavior. Mechanisms behind dissociation. Dissociation can be understood as a defense mechanism, where the mind segregates certain memories, thoughts, or feelings from conscious awareness to protect the individual from emotional distress. Neurobiological studies suggest that during dissociation, there are changes in brain regions involved in memory processing, emotional regulation, and self-referential thought. Types of dissociative disorders. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, identifies three main types of dissociative disorders: dissociative identity disorder, dissociative amnesia, and depersonalization/derealization disorder. Each type has its own characteristics and diagnostic criteria. 1. Dissociative Identity Disorder, DID. Formerly known as multiple personality disorder, DID is characterized by the presence of two or more distinct personality states or identities within a single individual. These distinct identities may have their own names, ages, histories, and characteristics. Symptoms. Presence of two or more distinct identities or personality states. Recurrent gaps in the recall of everyday events, personal information, and traumatic events. Distress or impairment in social, occupational, or other important areas of functioning. Symptoms are not due to the direct effects of a substance or a general medical condition. Etiology. DID is often linked to severe trauma during early childhood, usually extreme, repetitive physical, sexual, or emotional abuse. The disorder is thought to be a complex post-traumatic developmental disorder. Treatment. Psychotherapy, the primary treatment for DID, aiming to integrate the separate identities into one primary identity and to process traumatic memories. Medications. There are no specific medications for DID, but antidepressants, anti-anxiety medications, or antipsychotic drugs may be prescribed to manage symptoms of depression, anxiety, or other comorbid conditions. 2. Dissociative amnesia. Dissociative amnesia involves an inability to recall important personal information, usually of a traumatic or stressful nature, that cannot be explained by ordinary forgetfulness. This disorder can occur with or without dissociative fugue. Symptoms. Inability to recall important autobiographical information, usually of a traumatic or stressful nature. Significant distress or impairment in social, occupational, or other important areas of functioning. The amnesia is not attributable to a substance, e.g., alcohol or drugs, or a neurological or other medical condition. Subtypes. Localized amnesia, inability to recall events during a specific period. Selective amnesia, inability to recall some, but not all, events during a specific period. Generalized amnesia, complete loss of memory for one's life history, which is rare. Systematized amnesia, loss of memory for a specific category of information, e.g., all memories about a person. Continuous amnesia, forgetting each new event as it occurs, up to the present. Treatment. Psychotherapy helps patients recover lost memories and understand the reasons for their amnesia. Cognitive therapy assists in changing harmful thought patterns. Medication, no specific medication, but treatment may include drugs for symptoms of depression or anxiety. Hypnosis, sometimes used to help recover repressed memories. 3. Depersonalization/Derealization Disorder. This disorder is characterized by persistent or recurrent feelings of detachment from one's own body or mind, depersonalization, and/or experiences of unreality or detachment from the external world, derealization. Symptoms: persistent or recurrent experiences of depersonalization, derealization, or both. Reality testing remains intact during episodes. Significant distress or impairment in social, occupational, or other important areas of functioning. Symptoms are not attributable to the physiological effects of a substance or another medical condition. Treatment: psychotherapy, cognitive behavioral therapy, CBT, can help patients manage symptoms by changing negative thought patterns. Medications, selective serotonin reuptake inhibitors, SSRIs, or other medications may be used to treat associated anxiety or depression. Causes and risk factors. Dissociative disorders often stem from a combination of genetic, biological, environmental, and psychological factors. Trauma is a significant contributing factor. Trauma and stress. Childhood trauma, severe and prolonged trauma in childhood, such as physical, sexual, or emotional abuse, is a common precursor to dissociative disorders. Acute stress, sudden, traumatic events in adulthood can also trigger dissociative disorders, although this is less common. Psychological factors. Coping mechanism: dissociation can serve as a psychological defense mechanism to cope with severe stress or trauma. Personality traits: certain traits, such as high suggestibility, fantasy proneness, or a tendency towards introversion, may increase vulnerability. Biological factors. Brain structure and function: abnormalities in brain regions involved in memory, emotion, and consciousness, such as the hippocampus and amygdala, may contribute. Genetic predisposition: there may be a hereditary component, although this is not yet fully understood. Diagnosis. Diagnosing dissociative disorders can be challenging due to their complex nature and the overlap with other mental health conditions. Diagnosis typically involves clinical interviews, detailed patient history, including trauma and stressors, assessment of dissociative symptoms and their impact on daily functioning, use of structured interviews, such as the Dissociative Experiences Scale, DES, psychological testing. Structured clinical interview for DSM-5, SCID-5, specifically the Dissociative Disorders module. Minnesota Multiphasic Personality Inventory, MMPI, can help identify dissociative symptoms. Exclusion of other conditions. Rule out other mental health disorders, such as PTSD, depression, or schizophrenia. Conduct medical evaluations to exclude neurological conditions or substance abuse. Treatment approaches. Treatment for dissociative disorders often involves a combination of therapies aimed at addressing the underlying trauma, managing symptoms, and improving overall functioning. Psychotherapy. Trauma-focused therapy helps patients process and integrate traumatic memories. Cognitive behavioral therapy, CBT, focuses on changing negative thought patterns and behaviors. Dialectical behavior therapy, DBT, helps manage emotions and develop coping strategies. Eye movement desensitization and reprocessing, EMDR, effective for trauma-related symptoms. Medications. While there are no specific medications for dissociative disorders, medications may be prescribed to treat comorbid conditions such as depression, anxiety, or PTSD. Antidepressants, SSRIs or SNRIs, for depression and anxiety. Antipsychotics, for severe dissociative symptoms or comorbid conditions. Mood stabilizers, for mood swings or emotional instability. Supportive therapies. Family therapy educates and supports family members. Group therapy provides a supportive environment to share experiences and coping strategies. Hypnosis may help access and process repressed memories. Living with dissociative disorders. Managing a dissociative disorder is a lifelong process that requires ongoing treatment and support. Self-care strategies. Mindfulness and meditation help stay grounded and present. Regular exercise improves overall mental health. Healthy diet supports brain function and emotional well-being. Sleep hygiene ensures adequate rest and recovery. Building a support system. Therapists and counselors, regular sessions to address symptoms in progress. Support groups, connecting with others who have similar experiences. Family and friends, providing understanding and support. Coping with triggers. Identifying triggers, recognize situations that provoke dissociation. Developing coping mechanisms, techniques such as grounding exercises, breathing techniques, or journaling. Creating a safety plan, strategies to manage dissociative episodes. Challenges and misconceptions. Stigma and misunderstanding. Public misconceptions. Dissociative disorders are often misunderstood and stigmatized. Media portrayals, inaccurate representations in movies and television can perpetuate myths. Professional awareness. Lack of training. Some mental health professionals may not be well versed in dissociative disorders. Misdiagnosis. Symptoms may be mistaken for other conditions. Barriers to treatment. Access to care. Limited availability of specialized therapists. Financial constraints. Cost of long-term therapy and treatment. Future directions in research and treatment. Advances in neuroscience. Neuroimaging studies, improving understanding of brain mechanisms involved in dissociation. Biomarkers, identifying biological markers for early diagnosis and treatment monitoring. Innovative therapies. Virtual reality therapy, exploring new ways to treat trauma and dissociation. Pharmacological research, developing targeted medications for dissociative symptoms. Awareness and education. Public education campaigns, reducing stigma and increasing awareness. Professional training, enhancing knowledge and skills of mental health practitioners. Conclusion. Dissociative disorders are complex and challenging conditions that require comprehensive and individualized treatment approaches. Understanding the underlying trauma, providing effective therapies, and building a supportive environment are crucial for managing these disorders. Ongoing research and advancements in neuroscience hold promise for improving diagnosis, treatment, and overall outcomes for individuals with dissociative disorders. Through continued education and awareness, we can work towards reducing stigma and providing better support for those affected. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.